So this is what doctors say when they are graduating. And I have to tell you, mine was not it was modernized from this. And all I remember is the second paragraph was that we would honor our teachers. And I thought, I didn't like all my teachers. Why do I have to honor all my teachers? And I got stuck there. Now, I was only 26, so I was young, but I was literally stuck on that. And yes, I repeated all this stuff, but I didn't hear it. I will prevent disease wherever I can, for prevention is preferable to cure. I was taught it and I knew it, but I didn't have it outlined like this. So my point is just that it's really good you guys have it outlined, because it really is beautiful. Okay, back to social work. Sorry, I'll shut up about medicine mostly from now on. Okay, so they had a couple caveats on the web page. Of course, it's a process. This isn't finished. You're not done making these decisions, dealing with dilemmas. We never will be. There's no simple answers. And so you want to take into consideration your values, your principles, and the standards in this code. So decisions and actions should be consistent with the spirit of the code. Maybe not the words so much, because you won't remember them in the moment. And then instances will arise where you will wonder what to do when they occur. Make an effort to resolve it in a manner that is consistent with the values, principles, and standards expressed here. So, won't even let me advance correctly. Okay, so it's not a guarantee of ethical behavior. It's to help us resolve things. It sets forth values, principles, and standards by which we aspire, and we are judged. So this is our goal, and it results from our personal commitment to ethical practice and the commitment of all the social workers to uphold the respect for the social work profession. Beautiful. Oh, and I love it that self-care is included here, because you know what's not included with the doctors, right? They don't talk about this. But social work is such a smart profession that they talk about self-care, because we know you have to take care of yourself to take care of others and not burn out. So it's paramount, love that word, for competent and ethical social work practice. Yes, professional demands, climates. It's hard to maintain our personal and professional health, safety, and integrity. So we're aware of this. Organizations, agencies, and educational institutions are encouraged to promote policies, practices, and materials to support social workers' welfare. I am trying to help set up a Hawaii healthcare wellness program for all the health workers in Hawaii, because wouldn't that be nice to have a place to go to find out about self-care and fun stuff in the community? Not there yet. Okay, peer review. This is not what they're saying is what they're saying is these priorities, they are not priorities. They are not, they're just given to you in an order which is not the order of importance. So we'll just talk about them all, but we're not going to say, oh, this one's more important than that one. Although some of them I noticed had a lot more bullet points under them, and that's probably legal. Anyway, reasonable differences of opinion will occur the way you interpret these. And then decision making in a given situation would just be, your best judgment. And then there is a peer review process if it comes into question. Who do you ask if you want to know more? I found this picture online and I was so happy because I know Francie and I'm going to ask her to talk to us. But anyway, who are you going to call? You're going to call National Association of Social Work Hawaii branch. And let's see. I've got two new. Ooh, anyone have a case? Okay. Let's see. So get rid of that one and go here. Okay, so the ethical principles, they follow these are broad ethical principles: service, social justice, dignity, worth of the person, importance of human relationships, integrity, and competence. And this is what we all aspire to. So now we're going to go through the ethical principles that follow the values. Primary goal to help people in need and address social problems. Social workers draw on their knowledge to improve life of people in need. They're also encouraged to volunteer in communities for part of their time, which is beautiful. We're not told to do that. Well, maybe not in so many words. Next value, social justice. So social workers challenge the social injustice that, no, it's not popular right now. No, I'm just kidding. Social workers, they work to create social change so everybody has what they need. They strive to ensure access to needed information, services, resources, equality of opportunity, meaningful participation in decision making for all people. But we will talk about some cases where maybe somebody doesn't want the patient to know everything, because that's an ethical question I've been faced with. Okay, dignity and worth of the person. Um, you treat every person in a caring and respectful fashion, and you are aware of individual differences, cultural, ethnic diversity, and so you allow for self-determination. You seek to enhance clients' capacity and opportunity to change and to address their own needs. You're cognizant of their dual responsibility, your dual responsibility to clients and the broader society, which sometimes, are hard to balance. And you try and resolve conflicts between the two. So let's see. Importance of human relationships. I don't know if this was emphasized as much in medicine because, we're supposed to be able to take care of everything, right? Which is not the case. And yet many things depend on human interaction and human relationships. So I'm really happy this is identified right out front as a value. You understand the relationship between people and how important it is, and engage people as partners in the helping process so you can strengthen relationships among people. And you do it purposefully. And I just think that's beautiful. To promote, restore, maintain, and enhance the well-being of individuals, families, social groups, organizations, and communities. So at each level, trying to create those human relationships that will help people be their healthiest selves. Of course, you have to behave in a trustworthy manner, and care for yourself professionally and personally. Act honestly, responsibly, promote ethical practices. So that is the value of integrity. And then competence. You practice in the area of your competence. You know what you're good at, what you're not good at, and always strive to increase your professional knowledge and skills. And that's why you're here. Anyway, so the ethical standards. So there are 6 layers of ethical standards. We're only going to get to one, unless we have extra time. But social workers' ethical responsibilities to clients. So that's what I mostly looked up. Um, and here we are. 1.01. Your responsibilities to promote the well-being of clients, and their interests, while first, are part of their part in a larger society, of course. So they even give the example of responsibility to report a client has abused a child or has threatened to harm self or others. Okay, so our first case, which I have never had this, I have had a patient say, I've been abused. And if it's a kid, of course, it has to be reported. But I've never had someone say, I've abused another. So, so with this question, what would you guys do? What more info would you need to have? Well, you'd probably need to know how long ago. Oh, I'm getting chat. Excellent. And I found the chat. Let's see here. Was
Yeah.
it reported? Excellent. Right. Maybe somebody's gone to jail and they're out and they're talking to you about it now because they still have memories. Um, Time frame. Was it 10 years ago and they've been in jail, or did they go through um, a trial? What happened? Uh, how old is the patient? Okay, let's say the patient's in their 40s. Um, and then duty to identify the injured. Yes, and that's hard. Um, well, maybe they'll give you their name, but if they won't, how do you report it? Refer to a therapist. Are they elderly? Um, yes. What more? What more would you need to know? What if they said they did it yesterday and it's ongoing? I think you'd have to say, I'm a I'm required to report this to the police. Are you living with the person? No, no, you're seeing the person in a clinical manner. Yeah, we're mandated reporters, so we have to tell them we're mandated reporters. Child welfare services. Yeah, so we have to report this. If there's no name, I don't know. I've only done it from the child's side, and you call the police right then. Is the patient still living with the predator? Oh, good question. Um, okay, so explain you have to report it. Who is the person? We want to protect the person. Um, and so if they tell you the name, I think you would have to call right then. But if they're telling you they're feeling guilt and they're feeling all kinds of stuff, and you have a responsibility to talk with them, but you also have a responsibility to protect the child. Um, so um, talking with them about how to, and maybe calling Child Protective Services at this together. Is the person being abused vulnerable or disabled? Excellent question. Um, so yeah, this is an interesting situation. Um, more comments on that? So you guys are better at this than I am. All right, let's see here. Social workers respect and promote the right of clients to self-determination and assist clients to make choices and to clarify their goals. Um, you can limit the rights to self-determination when it's could pose a serious, foreseeable, and imminent risk to the patient or others. So that was it. I thought, well, what kind of situation would that work in? And then, so when I talk to med students, I talk about them. Let's say you have an elderly patient who has cancer, but the family doesn't want the patient to know. And in some cultures, that's how it was done. And so, do you go against their culture and tell the patient? It's an inner, there's no right choice there. So I kind of created this one. Let's say the patient has schizophrenia, but has a terrible bias against crazy people with those mental issues that they have themselves. Um, so do you say, well, you're talking about schizophrenia like it's a terrible situation? Oh, thanks. Sorry. Um, so do you tell them? The family doesn't want you to because the patient will get upset, but I mean, what do you guys think? If we are mandatory reporters, then update the patient of that and report, and all reports are anonymous. Got it. So that was for the last one. Refer to shelter if they live with the predator. Okay, sorry. Those are both for the last one. But what do you guys think about this? Would you tell that patient that they actually have schizophrenia and they're as crazy as those crazy? I'm kidding.
Kelly, can we respond by talking? Because I think like there's a lot too much to
Oh
say in
yeah.
that. So
Oh
it
yeah.
really would depend on what the social worker's role is in this setting. So were they diagnosed in an inpatient setting? And if yes, then the person who diagnosed them is really responsible for telling them, not the social worker. But if this is a client in a therapy setting where the therapist is a social worker and that therapist has diagnosed them, then absolutely it is if that person has the right to self-determination, if they are cognitively intact, they should know their diagnosis.
All right, and Renata says, yes, the patient should be informed of their own um, healthcare info in a manner that the patient can understand. Ah, all right. More comments? Thank you so much. Okay, now I moved my chat over to in front of the slides. Okay. Um, next ethical value is informed consent. So we've got two slides on informed consent. You, of course, want to be in a professional relationship. Um, you want to make sure people the opportunity to ask questions. If you need a third party there, of course, you should have one, especially for so they understand the relationship. If they're receiving services involuntarily, you have to provide information about the nature of the services and their rights to refuse services, because we all have that. And then you should discuss technology like telehealth, um, and how that works. And actually, there's special telehealth consent forms. And then you want to make sure that when you do use technology, you're talking with the right person and there's nobody else there. So you're not sharing, you're not making it a risky situation. And then um, let's see, you want to make sure that's suitable and they have the capacity for it. And then informed consent before audio or video recording and before conducting an electronic search on the client. Um, Now, I was wondering, so if I had been told by a client that they had gone to prison for molesting someone, I would want to confirm that, and I would probably do a Google search. So I should ask them if that's okay. Comments on that? I saw flickers on Zoom. There we go. One last question. Ask them if they resonate with the symptoms of this disorder. Slowly um, let's see, slowly legitimize and educate. That was a good one on the last one, the schizophrenia. Okay, next one is competence. Social workers should provide services and represent themselves as competent within the boundaries of their knowledge and training. So you should provide services in substantive areas and use intervention that are new to them only after engaging in appropriate study, training, and consultation with under supervision. And then you want to maintain standards in education, research, training, consultation, and supervision. So you want to take steps in those areas so that you keep people safe, like do no harm, like I said before. Use technology, you should ensure that they have the ability to use that technology. And then you should comply with all the laws governing that technology. And they're changing all the time, those laws. Cultural competence. Social workers should demonstrate understanding of culture and its function in human behavior, society, recognizing the strengths that exist in all cultures, which is a beautiful way to say it. Um, and then should take action against oppression, racism, discrimination, inequities, and acknowledge personal privilege. You should demonstrate awareness and cultural humility by engaging in critical self-reflection and recognizing as experts, everybody as experts in their own culture. And I like to think of the best way to learn about someone's culture is to ask them. what do you think in this situation? What do you expect from me? What would you like to have happen? Because that's it in their language, in their perception. Social workers should obtain education about and demonstrate understanding of the nature of social diversity and oppression, which with respect to oh so many areas of oppression. And social workers who provide electronic social work services should be aware of cultural and socioeconomic differences amongst clients' use and access of electronic technology. Now, on this call, on this, I was going to say program, but on Echo before, we've talked about training on how to use it. And of course, that would be important in this situation. Okay, conflicts of interest. I think this is the one we have. Oh no, next one. We have 3 pages worth. Anyway, social workers should be alert to and avoid conflicts of interest that interfere with the exercise of professional discretion and impartial judgment. So inform clients when a potential conflict arises and take steps to resolve it. In some cases, patients protecting clients' interests may require termination of the social worker. You should not take unfair advantage of any professional relationship, of course, not exploit others to further your personal, religious, political, or business interests. You should not engage in dual or multiple relationships with clients or former clients in which there's a risk of exploitation. You should, if you provide services to 2 or more people who have a relationship with each other, which is probably a bad idea, but there's spouses and um, spousal counseling together too. Um, then you want to anticipate if a conflict of interest could happen. And you should avoid communication with clients using technology without, for personal or non-work purposes. You should be aware that posting personal information on professional websites or other media sites might cause boundary confusion, dual relationships, and possible harm. Social workers should be aware that personal affiliations may increase the likelihood that clients may discover the social worker's presence on websites. Um, and actually, I don't do much social media, so I hadn't really thought about this, but that's true. Of course, I tell everybody, be careful what you put on the web because it never goes away. Um, and then you should avoid accepting requests from or engaging in personal relationships with clients or social networking sites or other electronic media to prevent boundary confusion. Sorry, I can't talk today for some reason. Too much holiday. Um, so yeah, I never really thought of that. Privacy and confidentiality, we've got 3 slides on that. Respect their privacy, of course. Just never disclose confidential information except with consent, and protect the confidentiality of all the information. Um, both the written, the verbal, any recordings, of course. If social workers plan to disclose confidential information, like that our client or patient had committed some acts of inappropriate you want to like we said, let the patient or the client know that you are a required reporter. Um, and then discuss with clients the limitations of their right to confidentiality, like in that case. And then social workers provide counseling services to families, couples, groups. You want to get the agreement of the parties involved concerning each individual's right to confidentiality and obligation to preserve the confidentiality shared by others. So in groups and group therapy, keeping the whole group talk confidential and reminding everybody of that. Inform clients if you're seeing somebody else in their group. Um, and not disclose confidential information to third-party payers unless, and we always have to sign that form when we see a new provider that we can disclose the information to their insurance company, which I always initially thought was weird when I started seeing that, but it makes sense because all their diagnoses go to them. And then social workers should not discuss confidential information electronically or in person unless privacy can be ensured. So you don't want to go to lunch and talk about it. And then you want to protect the confidentiality during legal proceedings to the extent you can. So that's a tricky one that I don't fully understand. Um, but you'd have to have advice from the lawyer in that situation. Um, Don't talk to the media about anyone unless your patient wants you to, and I'm not sure when they would want you to, but maybe. And let's see, take responsible steps to ensure that clients' records are stored in a secured location. We talked about that one before, and that um, your notes, both your notes, any recordings. And I find that my Zoom will not record because it's HIPAA compliant. So it just won't record and I can't actually copy anything in it. And I'm assuming that's because of HIPAA. And then, of course, your electronic communications as well. And, I don't think there are any communications on our phone that are actually completely safe. So even though people say, oh, texting is safe, and that thing that service that will delete something after a few seconds. Once it's out there, it's out there. So I don't think there's any safe way to communicate unless you're alone in private. But I'm hoping there is. And oh, maybe HIPAA compliant Zoom and other online services. But you really have to make sure that in the event of unauthorized access to client records, what do? We let them know. Yeah, and social workers should develop and inform clients about these policies consistent with the social work ethical standards, as well as the law where they practice. Okay, more privacy and confidentiality. Avoid searching or gathering client information electronically unless there are compelling reasons and with their informed consent. And avoid posting any identifying information, of course. You should transfer or dispose of your client's records in a manner that protects client's confidentiality, not just throw it in the trash, but shred it. Renata says, oh, make the print bigger. Sorry about that. I have seen bending of privacy rules. Many physicians and providers think that if discussing a case with another patient minus identifying info helps others, it is ethical. I've seen it be helpful for patients to know how others respond to treatment, but where to draw the line? Well, that's an interesting question. If I say, I have another patient that responded very well to this without any identifying facts, is that okay? Maybe they know that person. That would be bad. Yeah, that's a tough one. So probably best to stay away from it. Um, and oh, good, Renata has a case. So here's a question for you. Let's say you're super frustrated and need to talk about a patient with someone. What do you do? Anybody? I know I like to talk to my husband about de-identified general things. Talk to managers. Talk to your supervisor. Excellent. All right. Self-respect and schedule a consultation. Even better. Excellent. All right. Let's see. Access to records. You have to provide clients with reasonable access to their records. And you can have a misunderstanding with this that can cause problems. But should you limit your clients' access to their records? Only in exceptional circumstances. And you should develop and inform clients about these policies consistent with the prevailing ethical standards. And when providing clients with access to their records, social workers take steps to protect the confidentiality of other individuals identified or discussed. So here's a mini case. If a patient wants their records, you have to give it to them. But what if you are worried you said something that would injure their pride or something? What can you do? So the standards say you want to, it didn't say redact, but I would assume redact other people's names. What if you comment that they had the possibility of something and you think this will upset them, but they want their records? Any ideas? I suppose you can redact that part. Review their records with them and don't use the names. That might have been for the last question. So review the records with them. Yeah, because some people get upset, like reading, oh, I could have that. Oh dear. So that's a good idea, reviewing it with them. But say they want a copy, we have a right to the copy of our records. So patients can get mad, especially if it's for legal reasons and they don't like what you wrote. So uh, keep that in mind. Ah, okay. Ask them to put the request in writing. Have them sign a release for themselves. Schedule a time to review it together. You can decline if it's too harmful. Excellent. All right. See, I'm learning more than you guys, so I like this. Okay, sexual relationship, bad. Under no circumstances engage in sexual activities, inappropriate sexual communications through the use of technology or anything. Not engage in sexual activities with your client's relatives. Um, Stay away from their social group. Um, let's see, assume the full burden of setting clear, appropriate, and culturally sensitive boundaries. Social workers should not engage in sexual activities or sexual contact with former clients because of the potential for harm to the client. If social workers engage in conduct contrary to this prohibition or claim that an exemption to this prohibition is warranted, it, it, um, it is social workers who assume the full burden of demonstrating that the former client has not been exploited, coerced, or manipulated intentionally or unintentionally. You should not provide clinical services to individuals with whom you have had a prior sexual relationship. So, my case, what if you fall in love with your patient? What do you do? I mean, the first step is always to find them another provider. Um, but this says you just shouldn't engage with them at all. So, in that case, would you go to an ethics board and ask? Any ideas? Mary, Aaron, Marinelle, Renata?
Some states say that you can actually see a patient of like that you're related to or married to or in a relationship with if there is no other good um
Nobody else.
like nobody, like if you live in a small community, rural, or it's an emergency or something. I think Oregon used to have that law. I don't know if that's still part of
Interesting.
their system.
How interesting.
Yeah,
Um,
I believe that in social work there is no rationalization or justification to have a romantic relationship with your patient. You have to refer that patient to another worker.
can
Um,
you then though after they're at a values, you'll see it says not. So
Yeah, it says not, you have to refer the clients to another worker and make sure that you serve that relationship. Now, long ago, in 2005, back then, they did have something about after 2 years of not seeing the client, that there's a possibility that you may engage in a personal relationship. However, since then, all of that dual relationship stuff have been forbidden in our profession as a master licensed social worker. And we have to talk to the supervisor to have that patient reassigned. Once a patient, it's always a patient. So
Ah, yeah,
we, my understanding is that we cannot.
ever. Thank you, Shirley.
Absolutely, Doc.
All right. Okay. Physical contact. You shouldn't engage in physical contact with clients. If there's any possibility of harm, um, you're responsible for setting clear, appropriate, and culturally sensitive boundaries that govern such physical contact. Okay, what if your patient asks for a hug? What do you guys do?
Oh, we do it in front of people. There's no private behind closed door hugs and stuff like that.
Yeah, that's good advice. All right, sexual harassment, don't do it. Sexual advances, sexual solicitation. Of course, we just talked about that one. Um, oh, Shar says, great question, especially since hugs are common culturally in Hawaii. So, say, okay, come on out here, in public, I guess. Um, let's see, derogatory language. Social workers should not use derogatory language. Use accurate and respectful language in all communications. Payment for services, ensure that fees are fair. Avoid accepting goods or services from clients, although that is also culturally done some here. Um, explore and participate, should explore and may participate in bartering only in very limited circumstances when it can be demonstrated that such arrangements are an accepted practice among professionals in the local community. So that's interesting. And then social workers should not solicit a private fee or other remuneration for providing services to clients who are entitled to such available services through their agency. Clients who lack decision-making, um, um, you want to take safe steps to safeguard their interest and their rights. So they would probably have a decision maker with them or in contact with you. And then you should make reasonable efforts to ensure continuity. So if you are going to quit, leave, usually I know in medicine we have to give 30 days notice and offer other providers for them to see. Um, do you guys know if it's 30 days? All right. You can refer clients to other professionals if they have the specialized skills needed, and you should take appropriate steps to make sure an orderly transfer. And then you're prohibited from giving or receiving payment for a referral when no professional service is provided. And then termination of services, social workers should terminate services to clients when such services are no longer required or they're no longer able to help the client, and take reasonable steps to avoid abandoning clients in need of services. Social workers in fee-for-service settings can terminate services if they're not paying, but again, I think you need to give them a month. And they should not terminate services to pursue a social, financial, or sexual relationship with a client. Going back to our in love question, sorry, don't fall in love with your patients. Social workers who anticipate termination of services should notify clients and seek the transfer of their clients to others. And social workers who are leaving an employment setting should do the same thing. And I do think it's 30 days. Does anybody know?
If we can hand off our caseload in 2 weeks, because
To
leaving a 2 week notice is adequate for me for leaving an organization. But I need to in the 2 weeks and let them know that I'm transferring their cases to one of my coworkers, and always a warm handoff by introducing the client to their new provider.
that is very ideal, Shirley. Thank you. So we've gotten through the ethical responsibilities to clients. I don't know if this was helpful for you guys to see it, but and sorry, the type was kind of small. It'll be on the website, so you can download it if you want. And let Shar know, you don't have to you don't have to tell me. Let Shar know if this was helpful for you. But I'm definitely going to ask Francie to give us a talk on ethical of ethics, social work ethics, because I know you guys have to have 3 before June 30th. I don't think we're going to get 3 in, but I hope this one was helpful. So I will turn it over to Renata, who has another case. Oh, there are different ethical guidelines based on social work, psychologists, LMFT. For instance, social work are never allowed to be romantically involved with a past client. Psychologists are technically allowed after